right, Gannon. Joining us in studio this morning, Dr. Brooke Chalk, an OBGYN with Glen Mead Women's Health Center here in town, talking about women's health, obviously. We're going to focus on heart health today because it is Go Red for Women. Is that tomorrow?
Yes, February 1st starts, which hard to believe tomorrow is February
and
already.
The month of February is, what's it billed as? Is it Heart Health Month?
Heart Health for Women.
Heart Health for Women. When we talk about the heart specifically for women, this is going to sound so stupid when I say this. I apologize. What is the difference between your heart and my heart? Are there differences between gender?
So absolutely there are. I think the most important reason why the American Heart Association really started doing this Go Red for Women movement is there's a lot of misconception about heart disease in women and how dangerous that is. Mm-hmm. Most people, I would say, probably don't know that the #1 killer, the #1 cause of death for women in America is heart disease. And I would say most people don't know that. A lot of women probably don't know that. That sort of is the perception that that's a man's disease, and a lot of women are scared of other things, at least the women that I see. Sure. You know, maybe breast cancer, ovarian cancer, lung cancer, colon cancer, and certainly those are things that we should be vigilant about screening for, but those in reality are not the things that, you know, actually are deadly for most women.
This, though, is something I would think, while it is the #1 cause, this is almost something that can be prevented.
Absolutely.
From even happening all to begin with.
Absolutely. So, and I think that's what's so important about the education piece. Heart disease kills more women in the United States than all causes of cancer combined. Wow. And a lot of heart disease, I mean, you just hit the nail on the head. A lot of heart disease is preventable, but you have to know your risk factors. Sure. So risk factors are very similar between men and women. So I'm here talking about heart disease in women today because that's who I take care of. But the risk factors for heart disease really are similar. High blood pressure, high cholesterol, smoking, obesity, physical inactivity. All of those things are risk factors for heart disease in both men and women. If you think about it also, those things are all modifiable risk factors, meaning, you know, there's a way for us to prevent and or treat those risk factors, which, you know, whether that's medication to control cholesterol or blood pressure or just through, you know, weight loss, physical inactivity is a big risk factor.
Yeah, because as you were saying it to me, as you're running down the checklist, I'm thinking, okay, well, that's diet, that's exercise, that's don't smoke. Those are all things that you
Absolutely.
Control yourself. I know they're going to give us a wrap here quickly, so I want to get to one last thing. If you are someone at home that's watching this and you're starting to think, you know, I haven't felt right, I've had maybe shortness of breath. What are some of the signs that people need to pay attention to at home?
Absolutely. So the first thing I would say is know your numbers. See a physician, whether it's primary care, cardiology, gynecology. Know what your cholesterol is, know what your blood pressure is. And then the other thing, the big difference in men and women is the symptoms. So a lot of men will have that crushing chest pain symptom. That's not how heart disease will present in women. A lot of women can have jaw pain, shortness of breath, nausea, vomiting. So the bottom line is if something doesn't feel right, get checked out. Yeah. Listen to your body.
Yeah, and this is always my tagline here, where I say, you know, don't listen to me, because people will call and they'll email me. You would talk to the doctor.
Absolutely.
Even if it is as simple, I say simple, as your general practitioner.
Absolutely. Start there.
And then work your way up the chain.
Yeah.
Thank you for coming in.